So we're going to talk about 5 different, and they're very different ways that you can improve on the neck. And the nice thing is that it's a sort of a broad, ranging option for treatments. So there's something for everybody here. So we're going to talk about Botox treatments of the neck bands. 2 relatively new treatments called Kybella and Coolmini, which address the layer of fat in the neck. Traditional neck liposuction, and then probably the most definitive way of improving the neck, which is with a neck lift or a neck lift combined with a mini lift or a lower face lift. So, just in terms of the anatomy, it's very important for us to sort of understand what are the areas of concern in the neck. So we have 3 layers that are of primary concern. There's the layer of skin. Underneath that, there's a layer of fat. And then underneath that, there are these 2 sheets of muscle that all of us have in the neck. There's one on each side. So this illustration here indicates 1 sheet on this left side, 1 sheet on the right side. It's called the platysma muscle. So when we're younger, those 2 sheets are joined together in the middle, and as we get older, they separate and they fall forward. So that's why you start to see the vertical bands in the front of the neck, because those bands are the front edges of each of those sheets of muscles. And why from the side view you kind of lose your angle, because that sheet is falling forward. So a lot of people think it's just skin or just skin and fat, but actually one of the main culprits is those 2 sheets of muscle. So it's extremely important, at least when we're doing a neck lift, to address those bands. So what you might notice is that there's a little bit of extra skin here, and then you're such a good sport, by the way. This is not easy.
This is going to be good.
So you're great. You're doing great. So there's a little bit of extra skin, and there's some banding here. So those are the vertical bands, okay? And there's just a little bit of fullness here. And then maybe this volume used to be back up into the cheek area. So the whole idea with the neck lift would be to redrape the skin, okay? And people ask how much can that be improved? So when I feel the neck, your neck structures are all the way back here. So this is your thyroid cartilage and everything like that. So it's not like your neck structures are right underneath the skin there. They're all the way back here. So the extent of improvement that she can get is all the way back there, and we would remove some of that fullness there. So with the neck lift, again, we make a little incision, lift up all of the skin, surgically remove the fat, bring the bands back together to create that muscle sling to support the neck, and then that gets pulled back here. And then we move on to the lower face. We design the incisions to be really well hidden around the ear. We lift up all of the skin, and then the critical aspect of the lower face lift is that there's a layer of muscle underneath the skin. It's called the SMAS layer. That's connected to the jowls. So these jowls here. So we lift that up and back. So we do not pull straight back. That's a horrible look. It looks terrible. So it's always up and back. And when we do that, vector makes it so that the volume here moves back up into her cheek area where it used to be. So it eliminates sort of the squared appearance, and it makes the face look a little bit more oval or heart-shaped. So more volume here is good, less volume here is good. And once we move that volume up here, we also get a tightening in the neck because of that muscle sling. All of a sudden there's a lot of extra skin covering the ear, so we remove that and we tailor it. And we tailor it in such a way where the stitches, again, are really well hidden. And once it all heals, it's extremely difficult to see the incisions. And that's it. Pretty easy, right? One other thing that we do a little bit uniquely here is at the end of the surgical procedure, we treat your facial skin with one of our FACS lasers. So it's complementary, it's the Fraxel Dual. And the reason we do that is because it improves your skin quality. You know, surgery doesn't really change your skin, but the Fraxel does, so it complements the two. But the two are complementary.
What is Fraxel?
So Fraxel is one of our lasers that we use to build collagen and take away unwanted brown pigment. Fullness fits into this kind of handpiece, then you're a good candidate. So that's the area where Coolmini.
It doesn't really, no.
It doesn't really. It doesn't really.
Good for you.
And then with the Kybella, they actually provide each Kybella kit with this grid guide. So they make it very simple. So this kind of makes marks on the neck skin, and it gives Rebecca sort of a guide in terms of where to place the Kybella injections. So it's actually very precise, it's very sort of specific and regulated. It's not just kind of a, oh, we'll do it here, we'll do it there. It's a very precise, mapped out treatment. So you get a uniform, nice dissolving of the fat.
I have a question on the Kybella, as far as the actual injections go, because I know Botox is, you know, very almost superficial. They don't really, like, how deep does the needle go in with the Kybella?
So just kind of just underneath the skin.
It is, so
So
it
it's
is
in that layer of fat.
Okay.
Yeah.
So they're not like